Doctors have expressed their concern that a record number of sexually transmitted infections have been diagnosed in the UK. Figures from the Health Protection Agency show that almost 500,000 new cases were diagnosed in 2009. That's an increase of 12,000 on the year before. Well, experts say the under-25s are still most at risk, as our medical correspondent Fergus Walsh reports.
They're the health conditions which few talk openly about. For a decade, diagnoses of sexually transmitted infections have been rising, and the young are most at risk. Adam got chlamydia at 16 and then again in his early 20s. It took the second infection to change his sexual behaviour, because the first time round he says he didn't take it seriously.
I had unprotected sex, caught it for the first time, went down to the clinic and sorted it out. My attitude was I didn't really care because I knew I could just get it sorted out of a tablet, and that's exactly what I did.
Hackney in East London has the highest rate of sexually transmitted infections diagnosed in England, which shocks some in the area.
It's really surprising. It is really surprising, but I think education's what's needed, I guess, right from the school level.
Find it kind of surprising.
I think it's part of the atmosphere and the vibe around here. Maybe people should take a little bit more care, but I mean, you can't get the vibe without, some of the things that go with it.
The areas with the highest rates of sexually transmitted infection in England have several common factors. They're urban, with pockets of deprivation, and crucially have a high proportion of young adults. Most are in London, but Nottingham, Liverpool, Manchester and Brighton all feature. The peak for sexually transmitted infections in women is among those aged 19 to 20. For men, it's 20 to 23. 1 in 10 15 to 24-year-olds diagnosed will be reinfected within a year. Part of the increase in detection rates is due to more sophisticated tests and much wider health screening. But doctors say unsafe sexual behaviour remains a significant problem.
Sexually transmitted infections, if they are not treated, can lead to serious long-term health consequences such as pelvic inflammatory disease, tubal infertility, ectopic pregnancy. It is much better to avoid getting these infections so that you can prevent the long-term health risks.
Public health adverts have tried to raise awareness of the dangers, and sexually active under-25s are being encouraged to have chlamydia tests annually or whenever they change their partner. Fergus Walsh, BBC News.